Hi, I'm Dr. Kurt Woeller from Autism Recovery 101. As you know, autism rates continue to rise. In fact, at an alarming rate, they have been going up now for a number of years, and we're looking just even currently at 1 in about 68 kids being diagnosed with autism here in the U.S. Now, that doesn't take into account many of the other children who have just speech issues or pervasive developmental disorder, sensory processing issues, somewhere on that spectrum. So the numbers are increasing, and I know you as a parent, in the concern you have for your child and what can be done from a standpoint of treatment intervention, can also be a frightening and frustrating thing to be dealing with. Now, one of the things that's been happening in the world of medicine is more and more research into potential causes of autism. The problem has been is that most of conventional medicine is focusing purely on genetic factors that may or may not have a link. Now, we certainly know that many kids have underlying genetic problems, but that's not all of the story. The reality is vast majority of children on the autism spectrum, and that can also be for teenagers and some adults, have a wide variety of underlying medical problems, which is at the heart of many of their issues. The Centers for Disease Control here in the United States has acknowledged that individuals on the autism spectrum have a tremendous amount of what are called comorbid conditions, seizure disorders, allergies, asthma, etc., gastrointestinal problems as well, that are much more problematic in this population than in others. What I have done, and many other practitioners have done for many years, is implement what is called biomedical intervention. And that's the understanding that the vast majority of individuals on the autism spectrum, again, have some underlying type of medical problem or problems, and biomedical intervention addresses that, looking at things from an infectious standpoint, digestive problems, food sensitivities, nutritional imbalances, immune system imbalances, dysfunction as well. This particular course, this Autism Recovery 101 course, is designed specifically for parents who are either new to biomedical intervention, where you're looking for foundational information on diet, on supplements, on this relationship of yeast or bacteria problems, etc. Or perhaps you're a parent who has dabbled or maybe worked with a few things in the past, maybe diet or a few supplements, but just wants a refresher on the foundational aspects of biomedical intervention. And when I talk about foundational, this really goes to the heart of something I call the four-pillar approach, something that I've used for many, many years in my practice. And that is having a solid understanding of the importance of nutrition and diet, whether that's the gluten casein-free diet, specific carbohydrate diet, or others. That's critical because you're not really going to get too far in improving the health of your child if their diet is not healthy and optimized. Nutritional supplements are another pillar. Most kids on the spectrum tend to be very resistant or have a very poor diet. Not all, but many do. Self-limiting to their diet, very selective to certain things they eat. And so nutritional imbalances can be a problem. And so learning which supplements do what, how to use them, when to give them, what sequence to introduce them, and what are some of the problems that might come up with supplementation is also part of this four-pillar approach. Digestive system imbalances are huge. In fact, one of the comorbid conditions of autism is that autistic individuals generally tend to have worse problems in their bowels, whether it's loose stool or constipation, for example, than other groups of individuals. And this is something that I've seen for years and can be a contributing factor to many of the behavioral issues and sensory problems that children and teenagers sometimes deal with. Yeast infections, bacterial infections, and the toxins that they produce can have a wide range of negative influences on the brain and nervous system. And this is true and this is proven. And so this is something that is critically important to understand. The fourth pillar is something called methylation. And methylation is a complex biochemical system within our body that influences the brain and the nervous system and the gut and the immune system. Has a relationship to attention and focusing and language and sometimes socialization. And so as you step into this world of biomedical intervention and try to understand what all of these terms and these concepts are, you've got to have a good solid foundation in the 4 pillars. And that's the core emphasis of this particular course. So the Autism Recovery 101 course is essentially 6 core modules that go through those 4 pillars, and there's additional information as well on laboratory testing and how different lab markers relate to different behaviors, showing you how to interpret some lab tests like the organic acids test, for example, from Great Plains Lab. We'll go through that in detail. Also how to troubleshoot different behaviors and different things that you might see going on with your child. So things that can contribute to aggression or irritability or self-stimulatory behavior or sleep problems, for example, is critical as far as your knowledge base. And it's my passion really to help bring this information to you as a parent, because where you're going to go in helping your child or loved one with regards to biomedical intervention and other things that you might be trying to do with them is for you to become empowered through self-education. And so everything that I've created for this course is designed for a parent to be able to easily understand and easily assimilate. Now again, this course is for a parent new to biomed or perhaps just wants a refresher course on the fundamentals. We're going to, in this course, strip away a lot of the complex biochemistry, complex science that may go into some of the different concepts, different clinical aspects, not entirely, because we still have to have an understanding of how things work biochemically, but we don't have to get lost in some of the hardcore aspects of that. If that's what people are looking for, then the Adrenal Mastery course for health professionals would be a good way to go. My goal in this course is to give you concrete information that's easy to implement, quickly implementable, to help you become more successful in helping your child. Now, in addition to the core module lectures, we also have separate Q&A sessions, and this is an opportunity for you to ask specific questions about your specific child and different things that you might be researching. There's a forum that's attached to this course as well, and the forum is where you as a parent can post questions in a number of different categories related to biomedical intervention, and you can post questions on an ongoing basis, on a daily basis if you choose, and I'm active on that forum on a daily basis as well. We're also going to provide some interviews of parents who have been extremely successful in helping their kids with biomedical intervention, and a few of them having recovered their child, where they've essentially lost their diagnosis of autism through the approaches that I just mentioned, and a few others that will come up during the course as well. Also part of the modules will be support documents. These are handouts and articles, things that help to support the information that's coming forth through the lecture material. I'm also going to be including video instruction, kind of what you're seeing here now, in each of the individual modules as well. These videos can be about what maybe some of the handouts or different clinical tips and pearls that get you thinking about things with regards to your child's behavior, or what maybe certain markers on a specific test might indicate. So those are also part of the course as well. I think you'll find that the Autism Recovery 101 is a very comprehensive course of material for you, and really will help save and cut out really hours of study and confusion, because there's a lot of information on the internet, but it can be darn right confusing to really prioritize what you need to do, at least in the beginning early stages with your child, with regards to diet, lab testing, supplements, etc. So I encourage you to take a look at the information on this webpage. Email us if you have any questions, and I look forward to working with you within the Autism Recovery 101 course. Thank you so much.